Alright, first I'm going to go ahead and wash my hands, and I'm going to go ahead and greet my patient. Hi, I'm Josh. I'm a nursing student. Can I have your name and date of birth?
My name is Jernette First. My date of birth is October 11, 1969.
Okay, well first we're going to start with your neck for the range of motion. What we're going to go ahead and do is we're going to place your first hand under your neck for support. And then for extra support, you're going to put your other hand under the head. And so what we're going to do, we're going to do flexion, extension, hyperextension, lateral flexion, and rotation. Next, we're going to see the range of motion for the shoulder. So first, you're going to support the shoulder joint with one hand, and with the other hand, you will grab the arm. So to show flexion, we'll go ahead and pull the shoulder all the way back. And then for extension, you're extending it back. And then if I can have you turn on your side mom this way. And then you want to keep your hand on the shoulder joint. And for hyperextension, you're going to bring it back. Next, with our patient, we're going to go ahead and check the range of movement of abduction, like you're abducting somebody, it's coming away from the body, and then adduction, you're adding to the body. And then next, for the elbow and the shoulder, we're going to do internal rotation and then external rotation. And then lastly, for the range of motion for our shoulder, we're going to get our patient and we're going to get her arm, and then we're going to rotate it, and this is circumduction. And now we're going to focus on the range of motion for the elbow. So first, it's very simple. We're going to have her supinate her forearm, and it's going to be flexion, extension, slight hyperextension. And next we have our range of motion for the forearm. It's very simple. We're going to have pronation with the palm facing down, and then supination with the palm facing up. Supination like you're holding a cup of soup. Next, the range of motion for the wrist. It's going to be flexion, extension, hyperextension. And then you lay in the anatomical position, and then whenever you twist the wrist towards the body, that's going to be adduction, you're adding to the body. And then when you turn the wrist laterally, it's going to be abduction. You're going away from the body. You're abducting. Next range of motion is going to be for the fingers. We're going to have flexion. You're going to curl your fingers in. And then extension. Extend them out. And then hyperextension. Abduction. Your fingers are going away from each other. Adduction. They're coming back together. And next, it's the range of motion for the thumb. So we have flexion, we're bending the thumb down. Extension, we're bending it up. Adduction, we're adding it to the body. Abduction. And then opposition is where you can touch all your fingers together with your thumb. And that is opposition. Next, for the range of motion for the lower extremities, we're going to go ahead and do, for the leg, flexion, extension, and hyperextension. Next, for the range of motion is for the hip. You're going to have internal rotation, pointing the toes inward toward the body. And then you're going to have external rotation. And then you're going to tuck their ankle under your armpit, bend the knee, and this is going to be circumduction of the hip. And now for the range of motion for the knee, you're going to grab them behind the ankle and behind the knee, and it's going to be flexion and extension. And that's all. And now for the range of motion of the feet, we're going to go ahead and have dorsiflexion, toes pointed up, plantar flexion, toes pointing down. Inversion, the toes pointing inward to the body. And eversion, the toes pointing out. We're gonna have range of motion for the toes. So to bend them inward is gonna be flexion, extension, have them straight, and hyperextension, pulling them all the way back. And then I'll use my hand, so whenever you separate the toes, that's gonna be abduction, you're separating them, and then whenever you bring the toes back together, it's adduction, you're adding to the body. And that is range of motion.